Hi, I'm Ana Pereira, a research scientist at Transformation, a company based in the UK, and I'm presenting a comparison of nociceptive behavior induced by ultraviolet B radiation in rats and in mice. An acute overexposure of the skin to UVB radiation, commonly known as sunburn, has emerged as a highly translatable pain model. It induced similar thermal and mechanical hyperalgesia in both humans and rodents. A reliable and replicable model has been developed by Bishop and colleagues that mimics the symptoms observed in clinical settings. This model provides a great tool to investigate altered sensorial and neurogenic effects in vivo. The main signs of this inflammatory pain model are transient, with peak hypersensitivity between 24 and 48 hours of induction. The aim of this study was to compare the model in commonly used rat and mouse strains. We also aimed at investigating different mechanisms of treatment of nociceptive symptoms induced by the UVB model of sterile inflammation. In this experiment, we used Wistar rats and C57 mice. They were exposed to a range of UVB intensities from 500 to 1000 millijoules in rats and from 500 to 1250 millijoules in mice. Rats received lower radiation intensities due to being albinos and therefore more susceptible to UVB burn than their black-furred counterparts. Alterations in mechanical allodynia and thermal hyperalgesia were assessed at several time points using von Frey hairs and the hot plate test respectively. On day 2, at the peak of the model, each group received a dose of a gold standard anti-inflammatory drug or of a TRPV1 antagonist to assess their efficacy in reversing UVB-induced nociceptive hypersensitivity. In both rats and mice, all the tested intensities led to a significant reduction of mechanical thresholds, indicating the development of mechanical allodynia. Peak effects were registered at 48 hours after the induction in rats and 24 to 48 hours in mice. Effects started to resolve after the 48-hour time point, but there was still some sensitivity 7 days after induction. In terms of treatment efficacy, in rats, naproxen was effective in reversing mechanical allodynia in all but the highest intensity. The TRPV1 antagonist, though, increased mechanical thresholds in all irradiation intensities. In mice, both indomethacin and the TRPV1 antagonist were effective in partially reversing mechanical allodynia. The thermal hyperalgesia profile developed after UVB exposure was similar to the mechanical allodynia in both rats and mice. Latency to react to the heated floor was lower in all the tested intensities, peaked 48 hours after induction, and began to resolve after this time point. Treatment with gold standard anti-inflammatory compounds, naproxen in rats and indomethacin in mice, was not effective in reversing thermal hyperalgesia. Although indomethacin had a small effect, it was not enough to reach statistical significance. The TRPV1 antagonist, on the other hand, was very effective. All the group's latencies were reversed to levels comparable to baselines, indicating that targeting this receptor in this type of inflammatory pain model might present advantages when compared to traditional gold standards. In conclusion, we show that the UVB-induced inflammatory pain develops similarly in both rats and mice, with development of mechanical allodynia and thermal hyperalgesia. In addition, traditional anti-inflammatory compounds, while presenting some benefits in treating mechanical allodynia, are not effective in treating thermal hyperalgesia in this model. By blocking TRPV1 systemically, we were able to improve the two symptoms studied in this project. This study points to a lack of efficacy of traditional anti-inflammatory drugs in this model and to the need to develop targeted treatments for specific pathologies. Thank you for listening, and don't hesitate to contact me if you have questions or suggestions.